Hey everyone, it's Dr. Hodges. All right, I want to do some Medscape Monday. And what we're going to do today is take a quiz on managing obesity, bariatric surgery. Is it the most appropriate and for which patient group? So let's see if we can get as many questions right as we can. All right, so let's get into it. Let's test our knowledge. All right, so I really do appreciate that Medscape does these different tutorials for us and has these like little mini question sessions. It's great for me just because I'm a bariatric doctor, but then also anybody that has access to Medscape. So if you're a nurse practitioner, if you're family practice, you can also take these tests. And they have an entire section that is dedicated just to obesity, which is fantastic. They also have subspecialties like in vascular, they have OB-GYN, but I'm really happy that they're now having an emphasis in obesity because they haven't had that before. So, question 1, what is most accurate regarding obesity management? Is it aiming for 12% weight loss? Is it beginning with physical activity before changing your diet? Is it intensifying your methods if the initial intervention doesn't meet weight loss goals? Or should starting your goals for patients with obesity only be focused on body weight? And I picked C. And whenever I did this, you can see what all the doctors, like half of the doctors pick that. And that's exactly what the answer should be. And what I like about when I was reading the answer and like their ideas, what they're saying is that our treatment goals should really be based on an individual. So when you're seeing your patients, it doesn't need to be, okay, if this you hit this number, then you got to have this. If you have this, then you got to have that. Yes, I think BMI, weight loss goals, those are certainly going to be really good markers and good guideposts, but you really should have individualized plans for each one of your patients depending on what their health problems are. This reiterates in this answer that even just a 10% excess body weight loss is enough to have a significant improvement in your systolic blood pressure. That's the number on top of your blood pressure. It can significantly improve your fasting glucose as well. All right, let's see. Number 2. All right. Okay. This one is going to be a little tricky. Bariatric surgery is most appropriate for which patient group? BMI of 25 with a comorbidity, BMI of 35 with comorbidity, BMI of 30 without a comorbidity, or only patients without a comorbidity because bariatric surgery is contraindicated in patients with comorbidities. And just so that you know, a comorbidity just means you have high blood pressure, diabetes, you have some other health problem. What I'm interested to see about this particular answer is that our new bariatric guidelines would actually have me select this, which I agree with, but I'm wondering if Medscape is going to go with this answer. Let us see what they say. And yep. See, most people are still going by these old guidelines. We got new guidelines in 2023. And so this is incorrect. It says, according to ASMBS, you're considered a candidate for bariatric surgery if you have a BMI over 35, regardless of the presence or severity of comorbidity. But let me show you guys one other thing. However, but I do like how it says the same organization states that bariatric surgery can be considered to individuals with a BMI of 30 or 34.9 who have obesity-related comorbidities or a BMI over 27. Let me show you one other caveat to that, though. All right, I just pulled up our newest guidelines, and the newest guidelines say BMI of 35 or more, regardless of presence. Let's see if I can highlight this. Presence or absence or severity of obesity-related conditions, and it should be considered for people with a BMI over 30 and appropriately selected children and adolescents. But even without metabolic disease, the guideline says surgery, weight loss surgery should be considered starting at BMI of 30 if you do not achieve substantial or durable weight loss, or you don't see substantial improvement in your obesity-related diseases. So what does this mean? That even on Medscape, where primary care doctors are going to look, they're still not giving our updated guidelines, because our guidelines are specific. It's essentially, if your BMI is over 30, you're a good candidate for surgery. So it's regardless of what weight-related comorbidities you have. I mean, even if you don't even have any health problems, but you've been trying to lose weight and you failed, then you should be a good candidate for surgery. That's really what our guidelines are saying. All right. Okay, so let's see if we can do better on question number 3, but I do not agree with question number 2. Okay, it says, what is recommended in the 5 A's counseling framework? So during the assessment step, the dietary and nutritional aspects of weight loss are mainly discussed. During the advise step, community resources are distributed. During the arrange step, physicians screen for comorbidities and patient willingness to make health-related behavioral changes. Or during the agree step, behavioral goals are specified. All right, so why don't we go through the counseling framework for obesity? Okay, so these are the 5 A's. Ask, assess, advise, agree, and then assist and arrange. So the first one, they say ask. So seek permission to discuss weight and explore the patient's history, readiness, and motivation for surgery. I recently made a video on this. I don't know if it's been posted yet. And it was on the Canadian recommendations for bariatric surgery and obesity management. I have to tell you guys, I do not agree with ask. I think if we are doctors, then we just need to help our patients. So I don't know if you really need to ask. I feel like it still kind of plays into weight bias. If you take away the stigma, then patients can get the care that they need. So ask, assess, advise, and agree. So now let's go over here. So during the assess step, dietary and nutritional aspects of weight loss are discussed. Advise, let's see, what are these? So assess is when you're actually having your physical exam. So that's where you're looking at your history and physical. Advise is really whenever you're giving the people their plan and you're kind of talking about the risks and benefits. And then under agree, this is where you're setting specific goals. And then in assist and arrange, this is where you're kind of identifying barriers to success and where you're also getting referrals and follow-up of care. Okay, so back to the question, during the assess step, this is where you're discussing diet. No, during the assess step, that's really where you're taking their history and physical. During the advise step, this is where community resources are distributed. No, that's actually going to be during the last step. That would be during the arrange. So during the arrange step, so it's saying for C, physicians screen for comorbidities and patient willingness. No. Or finally, during the agree step, behavioral goals are specified. Okay, I think the answer is D. So let's see if we got that correct. Yay, we got that correct. All right. Now, question 4 out of 5. What is recommended regarding physical activity and obesity? Okay, you guys have heard me talk about this. At least 150 minutes a week of moderate physical activity is a standard management recommendation. Anaerobic isometric exercise should be started at the same time or prior to aerobic isotonic exercise. Oh my God, you guys. Anaerobic isometric exercise, that just means you are going hardcore, like weights. I don't think that they're going to want people to go into anaerobic metabolism. So I do not think it's going to be B. I actually think it's going to be the first one. So C is resistance training is usually contraindicated in patients who also have diabetes. That is incorrect. We're always going to recommend resistance training. And then finally, vigorous physical activity is rarely encouraged. No. I know that we want everybody to have their own baseline, but I got to tell you, I think it's going to be this one. 150 minutes a week. Y'all have heard me say that. 150 minutes a week. That's going to be roughly, let's see, if you're working out 5 days a week, that's going to be 30 minutes, 5 days a week. So yep, that's what it is. So they recommend at least 150 minutes a week or 75 in of vigorous physical activity a week. So you can do either or. But also, where they're saying anaerobic isometric exercise, that includes resistance training. While this form of exercise can help with weight maintenance and potentially increase muscle mass, patients may have a difficult time with that because it is much more strenuous and there is a little bit higher risk for they could have a little injury or you could be very sore afterwards, and that might serve as a deterrent for them to continue on. All right, final question. Question number 5. What is recommended as part of the pharmacologic management of obesity? Number 1, anti-obesity medications are only approved for adults with obesity. And remember, obesity is a BMI of 30. Certain anti-obesity medicines are approved for children. Lipase inhibitor is the preferred treatment for type 2 diabetes. Or GLP-1 agonists and SGLT2 inhibitors are contraindicated in patients who have obesity and type 2 diabetes. Well, first of all, you know that this one is not correct because that's what GLP-1s. So this would be Wegovy, Ozempic, Zepbound. I mean, that's what these were intended for. So we know that this is incorrect. Lipase inhibitors, these don't work very well. These would not be the preferred treatment for type 2 diabetes. It would certainly be a GLP-1. Anti-obesity medications are only approved for adults with obesity. I want to say that it's actually once you have a BMI over 27. I think that that's one of the recommendations. So I actually think it is B. Yay. Yep, there we go. So let's see. Yep, for kids, let's see. For children, short-term use of phentermine is approved for 16 years and older, and also like setmelanotide. What? I don't even know what that is also approved for children 2 years or older that have a genetic defect. So, all right, there we go. Okay. According to them, 4 out of 5 ain't bad, but I got to tell you, I think that that one question was incorrect. They did not follow our newest bariatric guidelines. So kind of get it together, Medscape. But hope that this was helpful. Maybe we can do another quiz together soon.